Welcome to the Collective NP Clinic's Mental Health Literacy Library, Mood Stabilizers, What to Know. I'm your host, Kara Leonard. So what are mood stabilizers? Well, this is a class of medication used to treat symptoms of bipolar disorder, as well as prevent future symptoms in relapse or exacerbations. These medications can also be used to treat things like borderline personality disorder, schizoaffective disorder, and even in the treatment of depression. The goal of mood stabilizers really is to balance emotions so they are more manageable. So the highs aren't so high and the lows aren't so low. There are several different types of medication that are effective in the treatment of bipolar disorder. Lithium is our oldest mood stabilizer and also very commonly used. Though very effective, lithium has a narrow therapeutic range and can have some pretty severe side effects if outside of that range. Lithium toxicity is a side effect in lithium use where there is too much lithium in the system and can actually make you quite ill. So blood work will be necessary to monitor levels of lithium in your system. Anticonvulsants, these are medications also used in treating seizure disorders, but are very effective mood stabilizers. So valproic acid or Depakote, Lamictal, Tegatrol, these are common medications used in this group. So there are some common side effects to lithium. Like most medications, upset stomach, including nausea, vomiting, and diarrhea can be common. You might also experience increased thirst and urination, or maybe some hair loss. Muscle weakness and fatigue can be common as well. And weight gain. Lithium is very dangerous in pregnancy, especially the first trimester. So if you're on lithium and thinking of getting pregnant, please make sure you talk with your provider. And then, as mentioned before, lithium toxicity. This happens when there's too much lithium in the system, and it makes us quite ill. Anticonvulsants have some similar side effects: the upset stomach, fatigue, potentially some weight gain, and some blood abnormalities. So lab work might be necessary with these medications as well. Anticonvulsants can be a little tough on the liver, and so especially valproate, and so we're going to be monitoring those levels as well. Anticonvulsants also interact with other medications, so that needs to be discussed with your provider if your provider is starting you on an anticonvulsant in the treatment of a mood disorder. Important to note, a rash is not a common side effect, but a very severe side effect. If you are on an anticonvulsant, especially carbamazepine or lamotrigine, and you notice a rash, talk to your provider immediately. This could be the sign of an emergency. Some important facts about mood stabilizers. Like other medications in the psychotropic class, these can take some time to work. Several weeks, up to maybe even a few months. So you've got to be consistent and patient and give these time. You might notice slight changes at first, but then greater therapeutic effect the longer you take your medication consistently. Always take your medication every day as prescribed, and never stop taking your medication abruptly or without consulting with your provider. Mood stabilizers, unlike antidepressants, are usually taken throughout a lifetime to manage symptoms of bipolar disorder. We hope you found this helpful. Thank you for listening.